We need a badge or something saying I love my liver, or a t-shirt. You should be wearing a t-shirt saying love your liver. Right, Dr. Farook, thank you so much for joining me. Another busy day, presumably.
Very excited.
You work at King's. How long have you been at King's?
About 3 months now.
Oh, congratulations. Where did you move from?
From UK, straight down here.
Oh, right. Goodness.
Yes.
And the big question, fatty liver disease, which I have Googled a little bit, which is always a bit dangerous. How is it here in comparison to back home?
I think one of the reasons really that I was moved over here was primarily to set up this program, fatty liver. So you can well imagine that this is something extremely common in this part of the world. And the more concerning thing really is that it's younger population that gets affected by this over here than it's back home. So let me give you an example. So in Europe, we say 1 in 4 will have fatty liver disease. So 25% really. So if you have kind of 4 people in the room, they would. But if you come down this part of the world, you would see it's 1 in 3. The most common risk factor is actually diabetes. And sadly, again, in this part of the world, it is much more common. It really is 1 in 5 of people that you and I meet every day in malls, in gatherings, that they're actually diabetic. And 1 in 3 have got fatty liver.
Those of the 1 in 5, very often, having spoken to another Dr. Khan, they don't know that they have it always, diabetes. No. So that also means presumably they don't know they have fatty liver.
Very true, very true. In fact, one of the problems that I come across with fatty liver is actually fairly asymptomatic. And if this is why I tell medical students as well, so as other doctors, the part of the liver that's affected by fatty liver isn't actually reflect straight away in blood tests, in liver tests, for example, and therefore patients continue to be living a very, very normal asymptomatic life by the time they actually know that it is far too late, and at this point scarring has kicked in. It is really insane.
So how long would you have it before, is there a time that you've got it before you know?
Yes.
Before you find out?
True. So from fatty liver, i.e. just a fatty liver without any damage, there is a rough guesstimate that it could easily be between 12 to 15 years before someone would get it. Yeah.
Gosh, that's a really long time.
And the problem is, particularly in this part of the world, I have patients with fatty liver as young as 18 years old. So you can very well imagine by the time they hit their prime lifetime, which is 30, 32, they've actually got damaged liver. And that's really scary to a certain extent. Okay, all right, I'm going to tell you this. 16.
16. And they actually had it?
Yes, and I'm not going to say the gender because it's, of course, patient's confidentiality really. We need to keep it as anonymous. They had actually liver damage.
So gone unchecked, that would have been, they wouldn't have been around for very long.
Yes, that's right, 15 years. We know, so they would have had it before they hit 30. It is very scary, Caroline. I mean, I know people think I'm probably a bit more eccentric, keep banging about this, but this is what I see every single day in my clinic. So that's where the genetics comes in.
Right, okay. So not, I mean, from your family, if your father's got it, rather than it being genetics as in being Asian or...
Right, so if you have a family history of fatty liver disease,
Right.
Again, that's very much genetics and epigenetics. And if you do know that your uncle, your aunt, your mum, your dad, and your brother, sister, they all have suffered a degree of fatty liver, then again, it is a risk factor. You need to get assessed. And actually, it's similar for both, if I'm being honest. But in certain studies, males thought to be more of a risk factor than female of disease progression, for that matter. And I'd certainly be very keen if patients are over the age of 30 for them to get tests. As I said, purely because
quite young.
I'm afraid so.
Yeah.
So my job is to look after people. And I normally say to them, look, if I catch you early, there's a whole lot of things I can do to alter the outcomes. Remember, we just discussed, it's 15 years. So if you had fatty liver, say, when you go into uni, you're out of the house, the mum is not watching you over your shoulders where you eat. And of course, there's a whole life that we start living. So it changes, the diet changes. And of course, not to mention the advertisement around the fast food is much more robust, if it's the word that I can use. And then the lifestyle doesn't allow us to cook organic, really. Well, I'm in the uni, thank you very much, I haven't got time, right? And most of us who then go western part of the world will have some sort of jobs to do to be able to support ourselves while we're students.
Yeah.
And again, so there are risk factors from late teens to early 20s that significantly contribute to what the dietary pattern is going to be. And even in Asians and Gulf, actually the diet that people consume is put them at higher risk of having insulin resistance at a very early age. So 30 is relatively a cutoff because you can come certainly before 30, but 30 I would urge people that when you get to 30, at least get tested for fatty liver, because then you would be in that sort of 15 years bracket.
So if you're over 50 and you haven't been tested, you would be saying, like this week.
Definitely.
Wow.
So to a certain extent, but again, it's a very important thing that you'd ask. So we did a study back home in the UK last year, and believe it or not, this concept of BMI, I'm now starting to even believe more that may not necessarily be true, because 26% of my patients actually had a normal BMI that had a fatty liver. So
26%.
Yes, so out of the 100% of my patients who had fatty liver, we looked at their BMIs, and as I just said, 27 for Asians, 30 for Caucasian and over, that should come forward. 26% of that cohort had actually normal BMI. Their BMI was 25, 26, some of them actually had BMI of 23. So these are the patients who are walking around, you and I wouldn't call them overweight or fat, but they have visceral fat. So they have fat accumulated in their organs rather than in their tummy. Yes, so waist circumference is actually one of the criteria that we offer the assessment. And it's 91 for females and 94 centimeters for males. And if your weight's there and thereabout, again, as you rightly said, this is another risk factor.
Right, so that would be a really good thing to do today, to measure your waist. So what was it for females?
So 91 centimeters for females and 94 centimeters for males.
God, it's not a very big difference, is it?
Well, no, and to be honest, if you look at different society guidelines, it changes, but I think generally speaking, and my take home would be, if male or female, regardless, if you've hit 90 centimeters, you really need assessment. Bottom line, that is, to keep it very simple and straight. And this is what I say to them. Look, I'm not saying that you would have a disease, but certainly if you've hit 90 centimeters, you probably get better checked out. And it is indeed, even if not about the heart, we certainly know that people who have fatty liver, if you look at their long-term mortality and the cause of death, if I'm being brutally honest, is actually heart attack and stroke. Most of them, because the risk factors that comes as a package of fatty liver, it equally affects the heart more, if not. Yes, so the end stage, Caroline, is scarring. We call cirrhosis.
Right.
Most of the people relate cirrhosis to drinking alcohol, but actually that's not strictly true. Most of patients that I see, particularly in this part of the world, is actually scarring down to fatty liver. Always remember, when patients of mine have got scarred liver, not everyone needs transplant. People who would need transplant are the ones whose scarred liver has stopped or relatively stopped working. Yes. And if you do have scarred liver down to fatty liver, there are things that we can do for you not to progress towards the failure part of the liver, i.e. needing transplant. So yes, even if you reach that far, there are things that we could do potentially to help. But the whole idea of my coming over here and starting this fatty liver program is that we assess people sooner before they get to that stage, because then reversal is definitely possible. Right, so again, very important point. No, everyone shouldn't go. And I normally say this phrase really, if you and I were to go to Mall of Emirates or Dubai Mall and grab 10 people and scan their liver, how many do you think will actually have fatty liver on the ultrasound? Just a rough guess.
You said it was 1 in 5.
Oh no, that was diabetes.
Oh, 1 in 4. 1 in 3.
Yes. So in our part of the world, it's 1 in 3. So you won't be surprised if at least 5 out of 10 would have fatty liver, but does all of them needs to come and see a transplant hepatologist? No, not necessarily. But who would then? So 5 risk factors, as I normally tell. So if your BMI is over and above what it should be, so 27 for Asians and gold, and 30 for Caucasians really. If you have got diabetes, very, in fact, the hallmark of disease process really. If you have high cholesterol, if you do have abnormal liver tests, all these really are the risk factors. Family history indeed. Okay, what does that mean? So this means that they need to be coming here and getting assessed. It's very important that we ascertain what stage they've got liver disease. If it's just a fatty liver, then their prognosis and their treatment options are very different, and lifestyle can help. But if they progress further, then they need different interventions.
But wouldn't it be good if everybody got tested so they could be alerted to the fact that they have the startings of a fatty liver, so they could change their diets and never get further down the road?
And then I think you're spot on, and this is exactly why our management, I must admit, they were very kind that they have introduced this liver package, which is really, really very cheap. I'm being honest, really. It costs 1,200 dirhams, I'm going to tell you now. But it gives consultation, it gives blood tests for cholesterol, for diabetes, for liver test, ultrasound, as well as fibroscan. So fibroscan is a special form of scan or a machine that I've got here in the clinic really, that allows me not only to assess the amount of fat in the liver, but it allows me to assess exactly the damage or the stage that your liver at. So we can therefore have a much more meaningful discussion about the lifestyle, about the diet, about the medical treatment, as well as endoscopic treatment to try and halt, if not reverse, the disease process.
Right.
So it depends what we found in the assessment, all right? So, okay, let me explain you this, and actually that message is very important to get across to the general public. Depending on what stage your liver is at, you need the intervention accordingly. Briefly, if you have a fatty liver, no damage, no diabetes, then you need around 5 to 10% of your body weight loss, which is a total body weight loss, for you to be not running into problem of A, diabetes, B, heart, and C, liver. The second category is where you've got fatty liver, but you've got diabetes and some level of damage, then you need diabetes people to look after you, and the weight loss you need is about 10 to 15%. So somebody who weighs 80 kilos will really need to come down to 70 at the least for try and reverse, if not control, their diabetes and liver progression. And the third category is you've got liver disease, you've got diabetes on top of fatty liver, then you need 20% or over body weight loss, all right, to try and control this. And therefore, they will be encouraged not only to see the diabetologist, but also because the other thing that I offer here is minimally invasive procedures to help people lose weight and control their diabetes as well as their liver disease. So that's a general ballpark, really.
Right. What do you think about the DEXA body scans that go through your whole body, the lying down ones, and show where you are storing your fat?
I think that's not a bad idea. It's useful to know. It's the organ fat that we as hepatologists are really concerned about, so fat in the liver for that matter. But for that, to be honest, Caroline, you don't really need to go through all those big body scans. As I said, a simple ultrasound scan that will tell us whether you have fat in the liver or not. And the more cruder way of looking at it, if you're diabetic, right, if you're over the age of 30, actually to be honest, any age, and if you have BMI of 25 and over, you're already ticking the boxes where at least you should go forward and get checked. We've opened the doors for everyone, really. And we here at King's, we've developed a team who deals with fatty livers. And it's not just me. And every patient who comes with fatty liver, and there is some damage or diabetes in the assessment, and get discussed by the whole team. So all the specialists sit down, myself, endocrinologist, dietitian, internal medicine, and we all then work out what is the best plan of action for that individual. So it's very tailor-made. And if they want to come and see the GP, we've got family medicine consultants, we've got health packages, we encourage people to come through, and some of them are actually covered by their insurances, and they can come straight through, or they can come and avail that liver package. As I said, that's 1,200 dirhams, and they can come straight to see me on that one. No, not really. I think as long as this healthy diet is proportionate to what you eat, and exercise really is the significant part of it. The beauty of liver is, as soon as you start losing weight, liver is the first organ that will melt the fat away.
Wow.
You may not notice. Yeah. You may not notice it on your face. I always say to my patients, why do you think I become a hepatologist? Because liver loves you. It really does. It is always on your side. If you stop irritating your liver with whatever has caused it in the first place, may that be fat, may that be alcohol, may that be viral hepatitis, liver will very quickly switch over to be on your side. And there's a capacity of liver to regenerate, to heal itself.
What would be the first change in somebody's life if I'm watching now and thinking, oh, maybe first they should come and get checked, and then you'll give them a whole list of things?
I think so. I think even if you don't really want to get checked, and you think, well, I'm not sure, I'm not overweight, I'm really 24, I'm not diabetic, why do I get checked? That's fine. But at least start thinking about what you're eating. Proportion of the calories is one thing, but actually what type of calories that I'm consuming. Is it really rich in sugars? Is it really rich in carbs? Is it really rich in fat? And then you ought to start thinking, okay, I've already got, depending on your ethnicity, because there's one thing that we haven't really talked much about, Caroline, is the genetics, the epigenetics. And there is reason that Asians and Gulf state have this insulin resistance more. Yes, of course, there's a dietary element to it, but there's also some genetics that would also, over the generations, have caused certain vulnerability, if I can say this, towards getting the fatty liver and disease progression to a certain extent. And I think small changes, really reducing your portions, changing from white flour bread, may that be pizza base, may that be white bread, may that be using cakes, dough, just change it to brown or seeded, more healthier, would reduce not only the calories, but the amount of carbs, sugars, as well as fat that is going in. Similarly, if you could reduce fast food, it will be extremely helpful. And that's all acceptable. But as long as I've managed to spark an insight as to what I'm going to eat or drink next, may not necessarily be as healthy as I thought previously.
How do you don't want to scare people, but how do you scare people enough to actually be motivated to lose weight? Because the overweight people know they're overweight. They know. But they don't want to do anything about it. Or maybe they want to, but for me, I want to be slim so much that I exercise every day and I'm very careful about what I eat. That's ingrained in my head. If you are not that way of thinking, how do you do your job?
If I'm being very honest, I think it's my fault rather than my patients or public. And when I say my fault, Caroline, it really makes me sad. I think I meant professionals. We somehow believed and made our patients and the public believe that fatty liver is nothing. Oh, don't worry, you'll be fine. I've heard doctors saying about the same thing about fatty. Oh, it's nothing. Go, you'll be fine. Just do some exercise, lose weight if you can, and you'll be fine. And as I said, that's true to a certain extent. When I, as a professional, carry that kind of plethora and messages about the disease process, how am I supposed to expect different feedback from my patients and from individuals who are coming to my clinic? So I think there's some information that's gone wrong from our end to the public, and therefore the insight. Now, everyone isn't as motivated as you are because they're not as much in contact with medical professions. They're not as much in contact with the study materials that there's got to be. And it's all about making people aware that fatty liver, most of the time, is yes, nothing to worry about, but actually 1/4 people with fatty liver may run into significant problems. So therefore, if I can build that insight into public, I'm sure that at least most of them, if not all, would start believing that what they eat and what they do for living, not exercise, not healthy lifestyles, would actually injure their health at a very young age. I don't need to use scary tactics. All I need to do is educate my people, educate the public, make people aware. And life is beautiful to everyone. People want to live longer. It's just me trying to educate people, really. And to be honest, no matter how clever I think I am, but you are more important than I am getting that message across to people and to the public, really.
I've learned so much today. I now know about fatty liver. I'm not sure if I should be checked, just to know where I stand now. I don't know. I don't know. I still don't know, even after our conversation. If my waist doesn't measure that, and I exercise every day and I have a healthy food intake, but probably too much fat because I do low carb.
Right. So we offer health checks at the age of 40 anyway. So even if you don't fall into any of those 5 categories, you will be picked up if you do your 40 health check.
Yeah. Is there a 50 health check as well?
Yes, there is.
Does it go up in tens?
Yes. You can come and have your health check at any point. we would welcome that at any stage.
Absolutely fascinating. Well, thank you. So my last question would be, you have a billboard on Shakeside Road. What's on your billboard?
It really is about the fatty liver. It is much common and more serious than we were led to believe. Please get it checked. The sooner we know, the better and easier it is to treat. That's
an awful lot to read while you're zooming down Shakeside Road.
That's true. That's true. So it's really how you look at it, to be honest. So I always say fatty liver is a serious problem. Please get assessed.
Right, right. And at such a young age, I think that is the thing that has shocked me most.
True.
Yeah. Thank you very much.
No, it was a pleasure talking to you.
Have a wonderful day and go forth and help people.
Well, that's the intention. That's why I'm here. I was brought here for a reason, and I'm hoping that I'm able to actually deliver this. And very kind of you to offer and help and support. And everything helps, really. Everything helps when you're trying to deal with something as prevalent as this, like a pandemic. And every single word of awareness is extremely helpful.
Right.
It really is.
Okay. It's a mission. Thank you. Bye.
Okay. Bye, Caroline. Bye-bye.